Then the second thing about 45 years old when it comes to getting pregnant is the health of your uterus, your ovary and your tubes. So as I mentioned many times, women who have never had children before tend to have more problems with their uterus. Or if you have not had children for too long, you tend to have more problems with your uteruses, like fibroids, cysts, endometriosis, polyps, all coming in. But not necessary. There are some women who are still very lucky with none of this problem. The lady I mentioned just now, who came to me, just married, 45 years old, AMH low, her uterus was perfect. When you scan her uterus, it was perfect. There was no problem. So between 8 to 9 months, she conceived. Then I had another case, also around 45 years old, never got pregnant before, but married for a long time, 5-6 years. There are multiple problems. Not that she never got pregnant before. She got pregnant and then she got ectopic pregnancy and then pregnant again and then ectopic pregnancy. And then she went for IVF because her egg reserve was so low, her AMH was so low. Her IVF did not succeed when she came to me. I found out she has endometriosis. I solved all her endometriosis by doing a surgery. And she got pregnant. She got pregnant twice. Twice at the age of 45. So even though your AMH is low, you can still get pregnant. But you still need to think about what about the health of your uterus and ovaries. So the health of your uterus and ovaries can still be affected at that age because it may not be so healthy, but it's not impossible. You can still do something to make it healthy back. Just like recently, I also had one case, very extensive endometriosis and fibroid, but she's 46 and she just got married. I mean, when she came to see me, who am I to say that, forget about it, you can't get pregnant, just go on with life. Who am I to say that, right? She just got married, she wants to have a baby. We definitely want to give her the best chance of getting pregnant. So I told her, since you've been trying to get pregnant for a certain period of time and you're still not pregnant, for people who are in their 40s, we don't ask you to wait 5 years, 6 months to 9 months, if you're not pregnant, we need to move on. You need to do something else. So in her case, we did a surgery to remove her endometriosis, to remove her fibroid. I just did it last week, and hopefully she will conceive soon. What else do we worry at this age? Actually, we worry one more thing is hypertension, diabetes, heart disease, stroke, kidney problem. So the question is, are you healthy? Are you healthy in your 40s? Your blood pressure is good. Your diabetes is not, you have no diabetes, you have no heart problem, everything is well, you're not obese, you want to get into another pregnancy, you think your body is healthy enough, well and fine. But we do know that people in their 40s, a lot of their chances of getting hypertension in pregnancy, diabetes in pregnancy, heart problem in pregnancy, stroke in pregnancy, all these, your chances go up. So blood pressure, of course, we always worry about preeclampsia. So in preeclampsia, do know that you can do a test and it's totally preventable. So normally when you're pregnant at 3 months, all you need to do when you're pregnant at 3 months is to do this preeclampsia test. It's not widely available. Please ask for it. It's available in Malaysia, but not everyone is doing it. Please ask for it because you're already in your 40s. Because if you have the blood test predicts that you are going to get preeclampsia in your pregnancy, then all you need is to take some aspirin to prevent the preeclampsia from coming. Then there's no risk for you and your baby. Diabetes, I would say most people in their 40s, especially Malaysians, with our Malaysian food, our char kway teow, our nasi lemak, our roti canai, and all our cakes and our kueh and our bubble tea. Oh dear, most of us will get diabetes if you're pregnant in our 40s. So even if you have no diabetes before you're pregnant, you can get diabetes during your pregnancy. So if you're in your 40s, my general advice for every pregnant woman in their 40s is to take care of your diet. Always cut down your sugar, cut down your sugar, cut down your sugar, cut down your carbohydrate. Don't eat too many sweet fruits, okay? And go and do your test in your pregnancy. The test where they drink the sugar water. Go and do the test. And then we can have tested, and then once you know whether you have diabetes or not, then we do what is necessary. Not too much of a problem, honestly. Most of the time it's controllable as long as we do what is necessary. Alright, so mainly it's still hypertension and diabetes. Unless you are already having hypertension and diabetes long before you're pregnant, then of course things like heart disease and stroke will also be a risk for you when you're pregnant. So you may need to be on aspirin.